Hi guys, Heather Peterman here. I'm coming to you with the next video in my series about adrenal fatigue. This is a series of videos that's gotten a lot of interest, and for due cause. There's a lot of people experiencing symptoms of adrenal fatigue out there, and I really want to spend enough time on this subject to get you guys some help and get you guys the understanding that you need so that you can feel validated in your symptoms and so that you can start moving forward with a treatment plan to start feeling better. So in the last couple videos that I've made, we've talked quite a lot about what adrenal fatigue is and what it isn't. We've touched on the pathophysiology, meaning we've touched on what creates adrenal fatigue, what happens to the body, and how it manifests. We've talked about the symptoms involved in adrenal fatigue and what creates that syndrome that we recognize as adrenal fatigue. And we've talked about trouble with the controversy and the acceptance from the Western medical community and what that means and how to deal with that. In today's video, I want to talk to you about how adrenal fatigue forms and how it starts and how it manifests. So this is an issue that we need to really clarify because I'm getting a lot of questions about issues like, if I only have some of the symptoms, do I have this going on? Or what happens if I have one or two things? And how long does it need to be going on before we can really recognize it? So here's the thing, adrenal fatigue can happen in a very short amount of time if the stressor is severe enough to cause your body to go out of balance. Or it can happen over a more prolonged period of time where you've had smaller stressors but that are sustained, so your body's never really had a break and a time to recover. So let's talk about where we are right now. We're living in the COVID pandemic. It's 5 months in. We've had business closures, we've had financial instability, we've had misunderstandings and all kinds of new restrictions put on us. We've had fear, we've had anxiety, we've had removal from the workplace and our social circles, and now we're facing closures of schools and much more social restrictions. So, this has caused an undue amount of stress. It has caused an unprecedented amount of stress for most all of us across the world. Nobody has been safe or sheltered from this. This has affected us all on some level. So what's happened in the last couple of months is you've taken all of your regular stressors that are already pretty hard to deal with. We live in a society where we're all go and we're no stop. We just go, go, go. We view everything as a fire and everything is emergent. And because we're fast-paced and digital, everything has to be now, now, now. So most of us are already living in that world. And then we were abruptly slowed down with all the COVID closures, and we faced unknowns that we still don't have answers to. So we had these stress levels that really compounded, and for most of us, that caused us to kind of go into a little bit of a spiral. I consider myself a really resilient person. I've bounced back from a lot of crap, guys. I've been through some really hard times. I've been through hard times personally, I've been through hard times professionally, and I've been through hard times as a parent. And I can usually bounce back with absolute resiliency. Going through this has caused some issues. I'm starting to feel the pull on myself. I'm starting to feel headaches. I'm starting to feel the fatigue. I'm starting to feel those symptoms that I'm recognizing as adrenal fatigue. And I realize it because I've been in these spots before. I've been in these spots postpartum, and I've been in these spots when I had my own business. And each time I've had to correct it and pull myself out. A coworker of mine who's a midwife reached out to me over social media and asked me to cover the topic of adrenal fatigue in the postpartum time period, and I am absolutely getting to that. I will make a video on 100% that topic because I think that's so important and it's so hard to bounce back from. And I can speak personally from that. I have twins and a 2-year-old, and my kids are, I had 3 kids in 3 years. So my kids are very, very close together in age, and it's very hard to bounce back from. So a lot of us women, a lot of us moms kind of already experienced a pretty extreme adrenal fatigue that happened in that postpartum phase. And if your children are relatively young, you might have still been in that period. Even if your children are 10, 15, 18, 19 years old, you may have never recovered from that. So, there are a lot of compounded issues, but now in this time of COVID, we have a whole new string of issues that we're dealing with. So what I'm getting at here, and I'm getting a little long-winded and off topic, but what I wanted to focus back on is that this is not something that just happens all at night or all at once, and everything happens all at one time. You start to notice the small symptoms. you start to notice the little things. So you might notice when you're starting to get a little bit of adrenal fatigue, you might notice that you're starting to feel a little bit more tired in the afternoon. A telltale sign is when you crash after you eat. So if you get that midday lull that happens around 2 o'clock, so you have lunch, you get a little bit of a boost, and then around 2, you start to feel like you're really in a lull, and it's hard to put yourself back into the place that you were before that, and it's hard to put your full energy forward. You feel like you could just go take a nap at that point. That's kind of a telltale sign that as a clinician starts keying me into an issue that there might be something going on with that adrenal complex and with your energy levels that way. Other things that you might start to notice right away, this is how it always manifests for me. I start to notice that I lose things. I misplace things. I misplace my keys, I misplace my backpack, my laptop, things that I need to have on me all the time, like my name badge at work to swipe to get in the building. It's something that I'm just used to doing and it's routine, and I just kind of go through the motions, but I start to notice that I can't remember where I place things, and it seems really absent-minded, and it's very frustrating when you're going through it because it makes you feel like you have an early onset dementia and you can't function or you can't think clearly. That's the other symptoms that people might start to notice, is that they can't form a train of thought like they used to, or they can't communicate as well, or they can't recall words or names like they used to. It takes them a minute. So things start to build up and you start to see that. And then it kind of moves into the bigger symptoms like the insomnia, the lack of sleep, the really mild cases of feeling a little bit disconnected, like you don't want to go out in your social circles. You don't want to participate in those group activities because you're just too darn tired to even get out and do it. Those things start to occur. And then when you move into the third phase of adrenal fatigue, there's 4 phases. So when you get into that third phase of adrenal fatigue, this is getting pretty serious. This is where your body is really starting to, we talked about this in previous videos. This is where your body has been producing cortisol for long enough that the demand for cortisol is too much for your body. And so your body starts to utilize the precursors to sex hormones to produce more cortisol. So it starts to take precursors that make testosterone, DHEA, and pregnenolone, and it starts to convert that into extra cortisol so that you can get a little bit more energy. But in this stage 3, when that starts to happen, that's where you start to see loss of libido, loss of interest with your partner, loss of sex drive. You start to see apathy and depression start to set in. And that's a signal to me as a clinician and anybody else who's working with you that this has gotten pretty serious and pretty severe. So if you're at that point where you're starting to notice those symptoms, really I urge you to get in and see somebody right away, because you really need to start fueling your body and giving your body what it needs so that it stops taking away from other aspects of your life. That affect, when that happens, when your body starts to rob the precursors to the sex hormones to make other things, that's called pregnenolone steal. And it's a very real and very significant issue with adrenal fatigue that we need to treat. So we need to support your body and give it what it needs to shut down that excess cortisol production and let your body start utilizing all of those chemicals, those bioavailable chemicals, the way that it needs to, so that you have all functions of life. I mentioned in a previous video, our body is brilliant, our brain is brilliant by design, and our brain is going to do what it needs to do to keep us going, to keep us fighting the stressors, to keep us alive. It's not going to be thinking about things like, do you have enough energy to go to the gym? Or do you have enough hormones to have interest sexually? Or do you have enough of what you need to enjoy your life? Your brain is not going to be thinking that when you're throwing so much stress at it, that your brain is going, if I don't do this, if I don't take this chemical from over here, this person is going to fall on the floor and they're not going to survive this level of stress. So your body is doing what it's meant to do by design, but in the meantime, that's costing you your quality of life. So if you come to an integrated medicine practitioner at that point, we're going to talk to you about lifestyle changes, we're going to talk to you about nutritional changes, and we're going to talk to you about supplements to get you back on track. Now, an issue that comes up all the time, I've told you guys I'm not a Western doctor, I'm a doctor of acupuncture and Oriental medicine, or a doctor of acupuncture and Chinese medicine, and A lot of issues that come up when I'm working with my friends and with my colleagues in the Western medical community is the distrust of supplements. So one place that we see this being abused is with adrenal fatigue, because with adrenal fatigue you do need to use a number of things to get a person back on track. But I see where patients go to see providers and the providers load them up on 8, 9, 10, 15 different supplements, and you don't need that much. You really need, 2 to 3 really quality supplements at a time, and you work in stages. So unfortunately, I do see it where there's a little bit of abuse from practitioners and maybe overprescribing, and I don't think that that's done purposefully or that's done maliciously in any way. I think that this is a complex issue and that providers try to go at it from all angles, and people who aren't necessarily in tune with working with adrenal fatigue or who haven't had a lot of experience with it come at it from too many different places at one time, and it gets too complex, and that's where you see the overuse of supplements. So I will caution you, if you want to start working through this, find somebody who has experience with adrenal fatigue. Talk to them up front about what you're comfortable with, what your comfort level is with using supplements, and work with them to make sure that you get a supplement protocol that will be effective but that you're also comfortable with, because you should never be asked to take things that you're uncomfortable with. And honestly, when you're dealing with a body that has been stressed out and that has been dealing with so much, if you throw too many supplements at them at one time, their body doesn't know what to do with them. It's like it's too much all at one time, and your body actually ends up causing more stress. So supplements work together like a symphony. There's lots of different things that are needed to make them work, but we should be doing it in a way that's responsibly and in a way that's comfortable for our patients and in a way that doesn't overtax the body. So as we work through the different stages of adrenal fatigue, if you notice that you're in that first stage where you're just starting to maybe get a little forgetful, your energy level is coming down, you're maybe not sleeping as well at night, or you're starting to forget things, you're likely in stage 1. That means that this is just starting. At that point, it's pretty easy to reverse. If you can get in to see a practitioner, or you can work with me, or you can work with somebody else to make some lifestyle changes and break that cycle of stress and give your body a break, we can likely reverse this pretty easily and pretty quickly with minimal to no supplements. If you're in phase 2 where things are really starting to progress, the insomnia is getting pretty bad, the fatigue and the exhaustion is getting pretty bad, and it's starting to affect other aspects of your life, it's going to take a little bit more. It's going to take some supplementation, lifestyle changes, and really you working with us to come up with a regimen that works for you. If we've moved into phase 3 where things are really getting bad, there's that loss of sex drive, extreme insomnia, apathy, and depression, it's going to take longer. And at that point, it can be 6 months, it can be even longer to try to get you out of it, but it's not too late, and we can certainly reverse it, and we can certainly get rid of that, get rid of those stressors and give your body a break. But if you're at that extreme point, it's really important to get in with somebody and start working at it. And then phase 4 of adrenal fatigue is where you just completely crash. So I see people in this stage that have other things happen. So basically, I've never seen anybody, or I never claim to see anybody who just falls over and collapses from adrenal fatigue. But what I do see is that they have other healthcare or other health conditions. They possibly have underlying chronic Lyme's disease. They might have other autoimmune disorders. They may even be oncology patients, or sometimes I've seen patients with Guillain-Barré that all of a sudden manifest, or other neurological symptoms. But at this point, your body has gotten so stressed and your immune system has gotten so taxed, and your body has just gotten to a point where it just can't really function in a healthy manner, and it's doing everything it can to keep you going. So these other underlying health conditions get exacerbated, and people end up hospitalized or with really complex other health issues that really knock them down. So just to clarify, it's not the adrenal fatigue that knocks them down, it's the other associated conditions. So if you see this going on, please get ahead of it. Do yourself a favor, reach out to myself or other integrated medicine providers, and let's get this information out there so that people can learn these symptoms and get everyone healthy again. Thanks for spending some time with me. Like, share, and subscribe my channel so we can get this information in the hands of people who need it. And please, the more likes I get, the more shares I get, the more subscriptions I get, the more this information circulates, and it's what lets me know that it's helpful so that I can keep making these videos for you guys. Thanks for tuning in. I'll see you in the next one. Bye-bye.